A high ankle sprain is a sprain to the syndesmosis ligaments. So I've talked in other videos about injuries to the outside ligaments here. But the syndesmosis is a collection of 3 ligaments, mainly, between the tibia and the fibula. There is the posterior one, there is the interosseous membrane, and then there is an anterior one, which is the one at the front. In trauma, you can tear all of these, but for a high ankle sprain, this usually refers to an injury to the ligament at the front here. So with low-grade injuries, this is where there is inflammation and some very minor tearing. You can go to a moderate injury, which is a grade 2, where there is some partial tearing, or a grade 3 injury, which is where that ligament is completely torn. How can you treat high ankle sprains? Well, if it is a low-grade high ankle sprain, is that you can treat this with some immobilization, obviously icing it a lot, and then working on the balance and stability and providing an environment where this ligament can heal up. And that treatment is very successful. If, however, you have a grade 3 injury where it is completely torn, or occasionally in some grade 2 injuries where there's a partial tear, but the remaining ligament has stretched, is that conservative treatment will not be successful. To correct this, what we do is reconstruct this. So we reconstruct it by we put a drill hole from the outside through the shin bone and then pass through the synthetic ligament, which has a metal button on the inside, a metal button on the outside, and as we tighten then, that will tighten up the gap at the front and provide a new ligament. And this is highly successful surgery, which has a really quite rapid recovery.